Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation is available on ATXN 3. To start, Austin Public Health Director Stephanie Hayden Howard will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, followed by Janet Pichette, Austin Public Health Chief Epidemiologist. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Stephanie, over to you.
Good morning. We know that there are some concerns about the weather. We are going to continue to monitor the weather to just determine how it would affect our vaccine appointments from today through Tuesday of next week. In the event that inclement weather causes us to make a change with our schedule, we will notify individuals by email, text, and phone call. We ultimately want everyone to remain safe. In the event an individual decides they will not be able to make their appointment, they can just reach out to us and let us know, and we will reschedule them. As we move forward during the week, we will continue to provide our vaccines next week. One of the things I wanted to share today is my concern about the number of African Americans that are receiving the vaccine. I'm also concerned about the number of Hispanics that are receiving the vaccines. It is going to be important for us as Austin Public Health to continue to work with the communities and be able to meet people where they are. We know that we have been having some challenges with the system. And so what we have put in place is that we have established an equity phone call line. And this line is going to be for outbound calls. That process did start about 2 weeks ago, and we have established more people to provide outgoing calls. We know that there are some additional partnerships that we are going to work with, and we will continue to work through our task force that have been established, as well as our vaccine coalition. At this time, I will transition over to Dr. Escott.
Good morning. Again, I'm pleased to report that our cases continue to decrease. Yesterday, we dropped below 300 on the moving average of new cases in Travis County for the first time since December the 9th. Our hospital admissions are dropping. Our hospitalizations are dropping. Our ICU utilization and ventilator use are all dropping. But it's important to remember that we can't let up yet. In particular, we're concerned about the B117 variant, which we know is in this community. We know it's around Texas, about 44 cases so far detected in the state of Texas. That means we have to continue those protective actions, the masking, the distancing, the washing your hands frequently, avoid touching your face, and staying home when people are sick. If we continue those protective actions, then by the time we hit March and April, we'll be in a much better situation in our community, and we can really decrease the impact of COVID-19. So we need folks to stay on board, to stay vigilant, and we'll all get through this together. With that, I'll transition over to Janet Pichette.
Thank you. Good morning, everyone. I'm just going to kind of piggyback off of what Dr. Escott had to say, and that is, even though we do have vaccines available to us, and we see a remarkable number of cases, our cases are dropping remarkably, it's a good sign for us in our community. However, we do know that there are new variants circulating, and we need to continue to be vigilant with the number of prevention activities that we follow to reduce disease transmission risks in your family. One thing we need to be mindful as you venture out, you need to make sure that you are following those prevention measures. that we always discuss, making sure you're socially distancing and wearing your mask and staying home if you're ill, most importantly. If you gather, we still recommend that your social gatherings, as we do our case investigations, we're seeing a lot of transmission risks still occurring with social gatherings and clusters related to that. So we're asking people to continue to gather with those people in their household only and limit their exposure, thus limiting the spread of COVID-19. I would like to also provide one additional reminder that has been related to weather, and that many of our Austin Public Health testing sites are currently closed due to inclement weather, but you can check our website to make sure to see when they open back up. With that, I'll move on to our moderator.
Thank you, Janet. This time, Louis Acosta from Univision will now ask questions on behalf of the media. Louis?
Good morning, everyone. Thank you for taking the time to answer our questions and for keeping us up to date providing these weekly updates. Our first question is from our station at Univision. Some doctors have mentioned that after both doses could last as short as 3 months. Do you have an update as to how long immunity could last once individuals get both doses?
I'm happy to take that question. The vaccine is new, and I think we're going to have to be patient to wait on the data to determine the length of protection. We've only started vaccinating here locally over the past month or two, and certainly nationally, we're in the same situation. So as we go through the months, we'll gain better knowledge, better data on how long that immunity will last. I think it's clear that it's not 100% with any of the vaccines. So right now we really focus on getting folks vaccinated as quickly as we can, but also reminding our community that even once you're vaccinated, you need to continue to follow those precautions, the masking, the distancing, the hand hygiene. I think it's likely that the immunity from vaccines will last much longer than 3 months. But also it's important to remember that immunity with any vaccine is variable across the community. Some people will develop longer lasting immunity, others shorter, and you'll have some circumstances where even after 2 vaccine doses, some individuals may not have a significant antibody response. So we'll be watching all those things as the months continue. And again, we're all hopeful that the immunity is lasting much longer than 3 months.
All right, our next question is from Community Impact. How many people have been connected to vaccine appointments as a result of the new vaccine phone bank?
I'm sorry, can you please repeat the question?
Yes. Next question is from Community Impact. How many people have been connected to vaccine appointments as a result of the new vaccine phone bank?
Well, to be honest with you, we did not bring that data to this meeting. I would have to get with that team to establish that. I will tell you that when we first stood up our process, the first day that line was open, it received over 2,500 calls. And it was so many calls that it was of grave concern, not only to Austin Public Health, but for the entire city. And so one of the things that we know is definitely we had to establish 2 other mechanisms. One is the inbound calls for the nursing line, the equity line that is making outbound calls, and then the third line with the partnership with Travis County to make outbound calls as well. That allows us to be able to reach people immediately whether they are referred to us by grassroots organizations or have left a message with us via 311. And so our staff will continue to reach out proactively and schedule those appointments in order to ensure, from an equity perspective, as well as individuals that don't have access to the internet, to schedule their appointments.
And I'll just add, I know I've heard a lot of concerns about people who are trying to scam individuals, or people who are taking it upon themselves to schedule appointments for the elderly at a cost. We do not recommend this activity, or you participate or pay someone to help you schedule your appointment, because oftentimes they're taking their money, and when they get to the clinical location, there's no appointment available for them. And it's very frustrating for both us to witness and for those individuals impacted. You know, I will say that Austin Public Health, when they do reach out to individuals, will not be asking for financial information. We will not be asking for immigration status or social security numbers. So please keep that in mind, that if somebody is asking for that information, we would not be doing that.
Our next question is from CBS Austin. Is APH planning to cancel vaccine appointments because of bad weather and unsafe driving conditions? And how will rescheduling them affect other appointments already scheduled?
We are going to monitor the weather the upcoming days. What we have established is to ensure the health and safety of our community. In the event we have to cancel a day, we've made modifications in the schedule that are starting effective February 15th. And that modification will allow us to meet the demand, even if we have to reschedule some of the appointments.
Our next question is from KXAN. Are we from moving to the next group, 1C, of people getting vaccinated, and who will be in that group?
I'm happy to take that one. You know, at this stage, there is no 1C for the state of Texas. The vaccine expert vaccine allocation panel is looking at 1C. You know, I anticipate that somewhere around early March, we may see rollout of 1C as more people in the 1B group are vaccinated. The federal strategy has been to do 1B and 1C in parallel. And the reason is, you know, when you focus on the 1B group, in particular individuals over the age of 65, the modeling suggests that you decrease mortality by 1 to 4%. If you focus on essential workers, those who are more likely to be exposed and to spread COVID-19, you decrease transmission by 1 to 5%. The federal government is sort of splitting the difference and focusing on both at the same time. I anticipate that the state will follow suit similarly and not wait for 1B to be completed before moving on to 1C. I anticipate it will be essential workers. They may provide specific recommendations for which groups of essential workers, but certainly we recognize that we have a lot of people working on the front lines in restaurants, in you know, as bus drivers, construction, a lot of other individuals who are still out working that have an exposure risk, and we would like to get to them as soon as we can.
From KUT, COVID-19 cases and hospitalizations have been going down. Why is that? Are we just far out enough from the holidays, or other factors are at play?
Well, I'd like to think that this has a lot to do with our community responding to the call for action. We saw uncontrolled surge in December and January to the point where our hospitals were overflowing and we had to activate the alternate care site. I think that people in our community heard that message. I think they responded. I think they stayed home when they could. I think they kept their kids home and transitioned to virtual if they could. I think people are masking here. I think they're distancing. I think they're following guidelines. And I think that has led Austin in particular and Travis County to falling more aggressively than some other jurisdictions. Again, our area was the last metropolitan jurisdiction in the state of Texas to enter into surge with hospitalizations for COVID-19 over 15% total hospital capacity, and we were the first to come out of it. But again, we've been in this situation in the past where cases were dropping, we relaxed too much, and cases have gone up again. So we've got to stay the course and continue those protections that have gotten us to this place. We're pleased to see cases dropping around the state of Texas and around the country. Certainly those are happening at different rates in different jurisdictions. But we're proud of what our community has done, and we're hopeful that they will continue that call to action until we can get down to stage 3 and then stage 2 at least.
And I'll just echo what Dr. Escott had to say. I think we're very fortunate to have a community that is responding to our call to action for public, implementing public health measures to protect themselves and their loved ones. I see that based on the response for vaccine, people want the vaccine and they want to return to normalcy. Again, we need to continue to be vigilant to make sure that we prevent and reduce disease transmission risks, especially as we have these new variants beginning to circulate in our community. And, I'm optimistic to see the numbers drop dramatically. I do often meet with other state epidemiologists throughout the state and other metropolitan areas. And they ask me all the time, what is it that you're doing in Austin? And I feel like we have a very responsive community that cares about our other community members. So I want to thank our community for following those prevention activities.
Our next question is from Co-op. A new preliminary study suggests that the B117 Kent variant, which can double every 10 days, is active in the US. What evidence is there of this variant being active in Travis County?
I'm happy to take that. Again, we've got multiple cases confirmed here. We've got 44 around the state as of yesterday. That doesn't mean there's only 44 cases. That means we only have identified 44, which means that there's a lot more than that. Again, it's hard to know what percentage at this stage is the 117 variant. The state is working on increasing their genomic surveillance. So that's the testing of the positive COVID tests for genomic sequencing to find out how many are 117 or other variants versus the original strain. And we're hopeful that they will do that. Right now, there is less than 1% of COVID tests which are that undergo sequencing. The state would like to get to 1%, but we are not there yet. So again, this is part of an overall public health strategy, biodefense strategy that the state needs, that we need as a country in order to monitor these variants. Again, this will become critical, particularly in the future, if we end up in a flu-like circumstance where we have seasonal COVID, where we can detect variants and we can formulate booster vaccines to identify the prevalent strains for the coming season.
And I'd just like to add, we are looking forward to DISHS being able to have the capacity to do that genomic sequencing to see if we have other strains in the community. I can say from our case investigation that the cases that we've had here have not had any travel outside of the United States. And so with that, it appears that, it's been circulating here. So I'm sure there are more cases in Travis County and throughout Central Texas. They've just not been able to identify them because the capacity for genomic sequencing hasn't been performed on their actual specimens.
Our next question is from the Austin American Statesman. Some Austin Travis County residents were very confused this week about second doses. CDC guidelines that Dr. Mark Escott quoted Tuesday about a 42-day grace period is only according to the CDC. If it is not feasible to adhere to a recommended interval and a delay in vaccination is unavoidable. Can you please clarify this process for residents about the efficacy of second doses if they had to wait longer for them?
Again, I'm happy to take this one. We certainly prefer to get the second doses as close to the 28-day interval as possible. CDC has been very clear it shouldn't happen before 28 days, but can happen after up to 42 days. So we're working hard to try to get it as close to that as possible. But it's important to remember that immunity isn't falling between the first dose and the second dose. The evidence suggests it's actually increasing. So when we look at less than 14 days after the first dose of the Moderna vaccine, the vaccine efficacy is about 50 to 51%. When we get out to over 14 days, it's about 92%. Overall, a single dose of Moderna, at least in a small portion of the vaccine, the studies of the vaccine, indicates that it's 80% effective at preventing COVID-19 with a single dose. So again, there is flexibility in that second dose. We will work hard to get people in as soon as possible, as close as possible to the 28 days. It may be 28 days, it may be 30 days, it may be 35 days. It's all going to be within the 42-day window for certain, but I imagine in most circumstances it's going to be within a week of that due date.
We're going to start our second round of questions. This next question comes from Univision. Can you provide more details on new strategies being implemented for outreach regarding the vaccine administration in Hispanic communities?
The department established several months ago the Latinx Hispanic Task Force Group. That group does meet a few times a month. Recommendations are provided to the leadership of Austin Public Health, and those recommendations are shared with the Vaccine Coalition group. What we've also done is we have members from the Hispanic and Latin communities that are part of the Vaccine Coalition. In addition to that, we have several nonprofit partners that provide us input about work that we are doing. We have many grants that will begin to start providing education as well as outreach in our community.
And I'll also mention we continue to work with other smaller groups. I am working with a group from the U.S. Hispanic Contractors Association and some other partners to start planning for that 1C phase when we can offer vaccines to larger groups of essential workers like construction. We need to have a plan in place, and I've been very pleased with the discussions that we've been having. We've got more work to do in terms of planning, but we're hopeful again that by the first or second week of March, we will be able to start to roll out vaccines to some of those essential workers. We're particularly focused on construction workers because of the great work that the University of Texas has done on modeling of the impact of COVID-19 on construction workers. And we feel that focusing some efforts on that group will help us to get vaccine to our Latinx community. Will also have significant impact overall on our disease transmission in Austin and Travis County. So we look forward to ongoing collaborations with them.
Our next question is from CBS Austin. How is hospital capacity doing with so many weather-related car crashes on top of COVID-19 cases?
The hospitals are doing fine right now. Luckily, when we look at big accidents like the one that happened on 45 yesterday morning, there were a lot of cars, but relatively few people hurt. Again, as we go into the colder weather and we have ice, we also see slips and falls. So we need people to continue to be careful on the roads, be careful when they're leaving their house, walking their dog. Lots and lots of falls associated with people walking their dogs and slipping on ice. So again, we need our community to continue to use caution with the inclement weather. And we all know Texas, and we know that in a few days it'll change. So again, hospitals are looking fine at this stage.
Our next question is from KXAN. Given that cases are dropping, do you plan to close the Convention Center Hospital?
We're going to continue to monitor the situation for the alternate care site. The number of patients in that facility has remained steady around 35 to 40 over the past week or so. Again, that site is able to support not only the Austin and Travis County community, but it can also have the capacity to take patients from other areas that are still underserved. So we'll continue to monitor the situation, and we expect that as those numbers drop, that we may consider putting it back in reserves. So hopefully have more on that in a week or two.
Our next question is from KUT. Last APH is proactively reaching out to pre-registered 80-year-olds to help them schedule appointments. One, through the list of 80-year-olds, what priority group will you focus on next?
We definitely want to continue to focus some of our efforts on individuals that are 65 years of age and older, but it is definitely going to be important for us to start to focus in on individuals that are 64 years of age and younger. One of my concerns, as I shared earlier, is that we need to increase the number of African Americans as well as Hispanic populations that have been disproportionately represented in the data, because we need to address how we can increase the number of African Americans and Hispanics that are receiving the vaccine. So it's going to be important for us to use that equity line that we have established to reach those populations. It's also going to be important for us to continue our task force with the African American diaspora group, as well as the Latinx Hispanic group, to make sure any kind of flexible changes that we need to make, because we need to be nimble in our operations. And so we are going to continue to modify our operations to increase enrollment on our platform, work with partners to do more outreach and engagement so we can increase those numbers.
And I'll add on to that as well. When we look at the vaccine that's been given out here in Austin and Travis County so far, about 70% of that vaccine has gone to individuals 65 and older. And we do continue to want to focus on that group because of the risk associated with severe illness and death in that age group. But as the hospital systems start to improve in terms of the numbers of hospital beds being occupied, we also have to take into account that individuals who are 64 and younger are more likely to still be in the workforce, who are in that 1B group. So not only do they have the risk of severe illness and death, but they also have a higher risk in many circumstances of exposure because they're still working, because they're still working in face-to-face frontline areas. So it's important that we start to shift our strategy to include more individuals who are still 1B, but younger than 65, to start to create that balance and ensure that we can have an effective strategy as we move through this pandemic. Again, we anticipate that our strategies will have to continue to change and be modified to meet the changing needs in this community. And Austin Public Health is certainly committed to making those modifications.
Our next question comes from Co-op. As vaccines become more ready, is it not prudent to inoculate the families and caregivers of those in phase 1 and 1B?
Oh, yes, absolutely. What you definitely want to be is in a place where you take advantage of the caregivers that are providing that service to our elderly population. One of the things that we are working on and have started that process is a mobile process for vaccines. What we've done this week is we provided vaccines in assisted living facilities. We are going to continue to span out and be able to provide some working with nonprofit partners that typically provide services to elderly populations. But we definitely want to be in a space from a mobile perspective that we can provide vaccines to people that are elderly, disabled, and include their caregivers.
I'll add on to that. The challenge is that in the 1B group already, who have already registered through Austin Public Health, we have about 180,000 people, and we have 12,000 vaccines coming a week. It's already challenging to meet the needs for the 1B individuals themselves and the 1A individuals themselves. So it's not practical for us at this stage to vaccinate all of the family members of all of those people. Certainly, as more vaccine becomes available, then we will expand the scope of who can get the vaccine. But I imagine again our next step after 1B is 1C, which will be essential workers still working in frontline positions, face-to-face positions. That's going to lead to increased risk of exposure. So we'll have to be patient and watch the state's recommendations from the allocation panel. And again, we are certainly ready to shift strategy as the state allows.
This is our final question, and it's from the Austin American Statesman. What is Austin Public Health doing to help residents who may have some distrust in science or the healthcare system still trust the vaccines that are currently on the market? Have any of these efforts from APH proven successful?
One of the things that has been helpful that we have started is we have started to attend town hall sessions as well as other platforms where we are virtually engaging with folks to talk with them about the vaccines and just being transparent and providing the information that we have present. One of the things that we always say as a disclaimer is that the information that I am providing you today is as good as today, because things are going to change as more information is developed and as time goes on with this vaccine. In addition to that, we have some providers and partners that have worked with us along the way to ensure that we are reaching target populations. So it's important about the relationships that we have with grassroots organizations. We have some 7 contracts that are mini grant contracts. They're going to be doing outreach and education in our community. But we know as we move along, there will be people that will be hesitant to take the vaccine. We know that there are some folks that will wait for others to take the vaccine that may be of an influence to them. And so we want to definitely work with those partners and, even look at the locations of where we're providing vaccines. We know that, we're in a couple of communities, but we may need to change to locations like churches. We also may need to, partner, at housing authority locations using some of their facilities. So as more vaccines become available, we've got to be able to use those strategies and meet people where they are.
Thank you. At this time, Stephanie, we'll start with our closing remarks.
We know that there are several concerns about the weather. We're going to do everything we can to communicate with you in the event that we may need to close our vaccine sites due to weather. I cannot tell you how concerned I am about the data with the number of African Americans that have received the vaccine thus far. Also, the number of Hispanic people that have received the vaccine. I am going to have some meetings with leaders in our community so I can hear from them directly and get, their support to say, let's all join in together to work together with Austin Public Health. Our task force have worked very closely together throughout this process, and we are going to continue to work with them and receive feedback from them. We know that Austin Public Health cannot do this work alone. We do, in the meantime, ask folks to really continue to wear your mask, watch your distance, and wash your hands, and stay home if you're not feeling well. At this time, I'll transition over to Dr. Escott.
Thank you, Stephanie. And again, Austin and Travis County, you're doing a great job. Our case numbers are coming down, our hospitalizations are coming down, and I think that's a testament to the work people are doing to decrease the spread of disease. We are concerned, however, that new variants may create a challenge for us. So we have to be vigilant about those protective actions. We have to stay the course, and it's important for us to decrease the spread of COVID-19 now more than ever, to decrease the risk of the variant spreading, and also to decrease the risk of new variants forming. So together we can get through this and certainly have a much brighter and happier summer this year than last year.
And I'll just add that as a reminder, our testing locations with Austin Public Health are closed until through Saturday. If you can consult our website to see when those test sites will reopen. And I would just like to say, just kind of reemphasize what Dr. Escott and Director Hayden Howard have said, that we need to remain vigilant currently. We do have vaccine on board. We are making every effort to reach out to people. As we reach out to people, be reminded that we will not be asking for financial information, for payment. We will not be asking for social security numbers or your immigration status. So feel confident if you receive a call from Austin Public Health to schedule your appointment, that we will not be asking for that information. And again, to remain vigilant as far as our disease prevention measures so that we can minimize the risk of exposure and transmission of COVID-19 and the variants that are currently circulating out there. Limit your social gatherings. We still need to be safe and keep our families safe. And with that, I'll just wish everyone a happy Valentine's Day.
Thank you. That concludes our media availability for today. Thanks to APH Director Stephanie Hayden Howard, Dr. Mark Escott, and Chief Epidemiologist Janet Pichette, and to our pool reporter Louis Acosta from Univision. Thanks for joining us, and please be safe.